So hello, everyone. I'm Melinda Morimoto. I'm the Senior Benefits Director at Genentech. We have 12,000 employees across the U.S., headquartered in South San Francisco, California. My team also supports our U.S. Roche colleagues, so about 22,000 employees plus their family members. If you're not as familiar with us, you can go ahead one more slide, please. We are owned by Roche, which is the largest diagnostics company in the globe. I'm very proud that we just launched a do-it-yourself pap smear kit. I kid you not. It's the Roche HPV self-collection solution, and it was named one of Time's 2024 Best Innovations. If you'll go forward another slide, please. About 3 years ago, our global Roche CEO launched what she calls the X Project. And it's really the idea that for too long, the default human has been the male body, and that we need to fundamentally think about women's health differently. So you'll see here a couple of things. You can go to Roche and look up the X Project. There's a phenomenal, like 1 or 2 minute film that really sets the stage about why we're talking about women's health. If you'll go forward another slide. From a corporate perspective, I do want to say we don't have any medicines for menopause, right? I'm really strictly talking to you from an employer perspective and how we take care of our employees. And what we're looking to do as an organization is catalyze a worldwide transformation in how we think about women's health and closing health equity gaps. And it's the first time I've been in this business for 33 years. I started with a healthcare company. It's only these last 2 to 3 years that we're actually putting a focus on women's health beyond pregnancy. So if you'll go for another slide, I want to share with you our menopause journey. You'll see behind me is the background. This is the actual stage 2 years ago where the conversation really started at Genentech. So Genentech Women's Professional Group is one of our business resource groups. This was a summit held where 4 leaders, senior director, VP level individuals were having a fireside chat, and they stumbled into the topic of menopause and how uncomfortable and impactful the symptoms were on their ability to show up and do their best work. Interrupted sleep, hot flashes in a meeting, cognitive, brain fog. And here they are at the peak of their careers, and this is real. And, some of the stats that we heard from the Stanford researcher is menopause is anywhere, perimenopause, from 6 to 10 years on average. Our average age as a company is 45. And at Genentech, we're 55% women. So when you look at our leadership body, this is a substantial portion of our employees who are going through a health condition that is impacting their ability to show up and be their best at work. But as women, we never talked about it. Once they started the conversation, the floodgates opened. So our chief people officer was on the phone with me within a day of, okay, Melinda, what can we do about this, right? As a company, we are committed to advancing health equity. What can we do about this? Fortunately, we had a strong partnership with our health plan, who'd begun a partnership with a company called Maven. We were able to implement menopause benefits within months. So we launched it on International Women's Day, which was March 8th, 2023. We immediately had over 500 people sign up within weeks. It's offered to every single employee, regardless of medical plan, as well as their partners and spouses at home. Some of the feedback we got in those first couple webinars, I've lived in shame for over 6 years. I'm so glad to have this now. Like, what a relief. I'm so proud to work for a company that's offering this benefit. And simply, feel seen and heard. So if you'll advance another slide, I want to talk a little bit about what the benefit is and what we coupled around it. So with Maven, it's a website that's available 24/7. It's completely funded by the company, so it's free to our employees and their partners. It provides vetted educational materials. There are over 30 symptoms that a woman can experience going through menopause, and it's different for each individual, and it comes at different ages, right? So it gives lots of information and education, myth busting, opportunity for provider-led sessions. One of the things that I think is most important, especially in today's environment, you heard about a lot of the OBGYNs have not really been trained in menopause. Real time, same day, next day appointments, telehealth appointments with specialists, OBGYNs, pelvic floor specialists, nutritionists, mental health therapists, career coaches. That gives the individual the opportunity to ask her questions, understand her symptoms, what her treatment options may be. And then if she wants to pursue something like hormone therapy or medical treatment, then she gets referred to an in-network provider where she can then seek that care. What it does is it gives her really fast, good information to then be empowered to have the right conversations with her clinicians. If you'll go forward another slide, please. We also felt as we're launching this new benefit that it was really important to educate our people managers. Okay, this is something we've not talked about in the workplace. It's uncomfortable to talk about it. And yet our women in our workforce are going through it for years. That's going to impact the whole team. We wanted our people leaders to really be informed, thoughtful, sensitive, supportive, understand what a woman might be experiencing and how best to support her. Um, my boss actually, someone came in with a small fan. She's like, who wants one? $15 on Amazon. She started handing them out like candy. There's some simple things you can do that are low lift, but there are other things that that take some more effort, right? So, we're looking at things like what is our coverage for hormone therapy? We had an employee who said, hold on, you're moving to a new formulary next year. There's nothing in the tier 1 lowest cost for progesterone. That led to a very thoughtful conversation with our pharmacy benefits consultants, with our vendors, say, how are we ensuring that it's cost affordable for women to get the care that they need? Other things that I would encourage as you think about potential legislation is also what are the workplace policies to support someone? 80% of our workforce is salaried, we have control over our time, we can take a break when we need to, but 20% of our workforce is on a manufacturing floor, on a shift in PPE, working in a warehouse. They don't have that same level of flexibility. So how might we support shift employees who need to take an unexpected bio break? So those are some of the things I would just plant as seeds, as opportunities for as we think about how we create that supportive environment. So last thing, if you go, I think it's one more slide. We were among the first 4% of companies to put in menopause benefits in 2023. I think we're up to about 15% of companies in the US in 2024. We had the absolute honor of being interviewed as part of the M Factor. So the M Factor is available through the 16th, I think, on pbs.org for free. It's a 56-minute video on menopause. Exceptionally well done. Most of the interviews are physicians about what women are experiencing, how to support them, but there is about 2.5 minutes in there about our journey and how we came to these benefits. Highly encourage you to watch it if you have a few minutes. It's very well done. With that, I'll turn it back to you, Senator.
Thank you. I would really encourage everyone to watch the M Factor. I mean, it's short. I don't know. For me, it was very therapeutic because I was recognized, and even being a part of this call where I see all these faces, I know that I'm not alone. I think someone put that in the chat. You're not alone. I think it's good to have that support. And I think it's interesting to have these kind of conversations where you think about it outside of just healthcare, but like what you can do to support the workforce, what we can do to support women in all kinds of different areas. So I know that we wanted to make this more interactive and give people the opportunity to ask questions. And I believe when you registered, we solicited some questions. So Shilpa, do we have questions? Do you have questions that
make sure? Yeah, we certainly do. And I can start. And if people didn't submit, you can put those in the chat and we'll try and volley between the two. So one of the first ones we have here, is there any progress on getting testosterone hormones covered by insurance? It seems as essential as estrogen.
I can start on that. And then Melinda, if you want to talk more private perspective on your plan. So the reason for our veto was in part because of just a lack of understanding. I'm going to be totally honest with you, and a lack of research. We were covering things that were being used off-label. Testosterone is one of those things that we are treated with off-label. And those of us that have been treated know that, and there's no way to get treated holistically right now without using off-label treatments for menopause. It's just the sad facts of what's going on. And so one of the things that we need to drive is research, and making sure we're doing the research in order to get FDA approval for on-label usage, in order to get the full bevy of benefits from our insurance companies. We drafted the bill to allow for doctors to be deciding what was necessary, and not the insurance companies, and then the insurance companies having to pay for it. And that was something our governor was not comfortable with. I think one of the messages that we are trying to hit home here as legislators in California is that our doctors are the ones best poised to decide how to treat us, and not the insurance companies who wants to save dollars. But I will say, Senator, that it looks like, fingers crossed, because California is the slowest state in the nation as it comes to voting and counting our ballots, we are going to get to a parity this year as well. We're going to have half women, 60 out of 120. So I think having a, not majority, but parity in the legislature will continue to move these conversations forward in an important way. But for us, one of the things we will be focusing on is, at least at our research institutions, how do we get more and more research into menopausal care such that we can get the FDA approval we need for this.
Great, thank you. Our next question is, I would love to hear about best practice examples with menopause healthcare coverage and what we states can do to support.
I would say the one thing that we looked at that's really amazing that I would recommend is England. They are leading the world as it relates to workplace accommodation. So we had an informational hearing where we had the legislator there, who's a menopausal woman, come on and talk about what the UK has done in their legislature to really bring workforce to the front as it relates to menopause in partnership with labor. That was actually how they achieved it. So I'm trying to bring our labor movement along, and this being a focus that they pay attention to. But that's one example that I would really look at as it looks to best practices. But besides that, there isn't much, to be frank.
Yeah, what I might add is, if you're able to offer education, fundamental education is a gap, not just with our clinicians, but with individuals. So providing education to your employees, to your people leaders on the symptoms, because oftentimes women are going down a path of, well, this, mental health or this or that, and it all comes back together, menopause. So being able to educate on what menopause and perimenopause might look like is a helpful starting point. Ensuring that you're covering hormone therapies and looking at the cost of those, that they're not the highest cost tier, which can be a barrier for many employees. And then I would say, again, really looking at the workplace policies. Every state has a different number of required protected sick leave hours. We increased to 40 hours in California recently. But hourly employees will really protect that time for when they most need it. So that's where someone may need to actually use their FMLA coverage to have intermittent unexpected breaks. So it's that education of what are the protections available to her so that she can manage a health condition while she's working.
I can tell you that I did do some research to see around the country, not just on the West Coast, on types of legislation that had been introduced. I know the Menopause Research and Equity Act of 2023 had been introduced federally. As it still had not passed, as things happen. You said things happen slowly in California. Obviously, we know in DC it moves even slower. We've had a lot of different things. state of New Jersey introduced legislation. And like I said, most of this legislation hasn't passed, but I think it does give us, this group, it gives legislators and policymakers some ideas about things that have been attempted, and can sometimes look at the veto messages and see what the problems were and what we need to do and where we need to continue to work. So New Jersey actually introduced a bunch of different types of legislation in 2023 around this area. One was establishing an interagency council on menopause in the Department of Health. One was requiring just simple menopause information be distributed under certain circumstances. In fact, you saw that in a couple other states where just women of a certain age, I think it was 40, just needed to be provided resources by when they were in doctor's offices for certain circumstances about menopause and perimenopause. There have been a couple states that have introduced days for Menopause Awareness Month. I normally am like, why do you have to do that? But I think we do need to bring awareness to something that affects over 50% of the population at some point in their lives if they are to live that long. And in New York, they presented a bill around workforce. I know Melinda had talked a little bit about looking at things that employees can do and what they can provide. That was providing 4 days of paid leave for menstrual complications and menopause and perimenopause. So people are not having to decide whether or not to come in when they are not going to be productive. Pennsylvania also required the Department of Health to provide menopause and perimenopausal education and more resources. So a lot of the stuff has just been on this like introductory like kind of area in that area. So I see some great ideas just in this chat. Like, is there any consideration or movement to require state medical schools to teach about menopause or symptoms? So that might be something that states can look at in considering as far as moving policy in their states forward. I don't know if you guys have any other thoughts, or if there's anyone on the call even that has had worked in this area that has some thoughts on this.
Yeah, I mean, I'll just reiterate something I said at the end, which is I do actually think the best way to get our medical schools, both private and public, to teach this is for us to test the doctors, right? I really just think that will be game changing. We as states adopt these medical boards, each of our licensing entities do that. And so I think pushing our licensing entities to require that is really something that we should be doing. And again, if more than one of us, I mean, I'm going to do it here in California, but again, if several states are saying this is what we want our licensed physicians to know, then I think that the private entity that establishes those tests will have to respond. And I think that will be game changing. So with that, I apologize that I have to jump off, but it was really great to be with all of you. Thank you.
No, thank you so much for being a part of this. Do we have any other questions on here?
We do in the chat. Let's see, we have, is there any consideration or movement to require our state medical schools to teach about menopause and symptoms, maybe require the study of, if there isn't enough to teach?
I think I kind of alluded to that, and I know RBK had brought up that information about how that is definitely something that when I saw it on there, I actually took out my notebook and I was like, oh, might be something that we need to do in our schools, and led me to realize I need to reach out to the deans of both medical schools that are in my state. So, I'd love to see if there's anything. Like I said, there's been just very limited work in this area. When I had CSG and some other organizations look into this, what I read to you was literally everything I found. And so I think there is a lot of opportunity for states, potentially people that are on this call, to be at the forefront and pass game changing and, unique and one of a kind legislation that will get that ball rolling in other areas.
Super. I'm going to take another one from the chat. Let's see. Do we have any data that can be utilized to estimate the economic impact of the status quo in individual states?
I think the only thing that we really have is the assembly member that spoke about what they do in California. I can't remember what that. Do you remember what that process that California legislature goes through in determining what the costs are to insurance?
Right. It's through UC Berkeley, the CHIRP program, and it's actually linked to this Zoom invite. So I'll drop the link in the chat.
I think that's probably the only thing that we have kind of at this point, because legislation in that state required that kind of analysis on what those costs would be and what cost considerations there would be in that area. So I would say probably based on what I've seen, and there might be other people out there that have other knowledge if they've started working that, but that's kind of where they would do. Yes. I see it linked in here as well.
Here we go.
I think also building some broader coalitions, like she had mentioned, how there has been some, policy making in Europe around this area, and they were able to partner with a lot of their labor organizations. So I think, that's probably something that we can look at. Obviously there's a lot of people in the medical fields, whether it's nursing, doctors, medical schools and education like pieces. But I think also, and part of the reason I'm so glad Melinda was a part of this is I think we should also start thinking outside of the box and how we can partner with our labor partners about including this in, legislation around that area to protect women in the workforce. We can't complain about how women have left the workforce, but we still don't do anything in addition to not providing childcare. Even when children are no longer like something that they have to be concerned about, we don't also provide, those resources and that support for people with other healthcare issues.
Well, in regards to alliances, I think our colleague here in the East, Shirley, who's the health policy consultant, suggested the American Academy of Nursing, as they have a policy group that's focused on women's health. So I know, Shirley, you're going to share this with them. Thank you so much.
Does Shirley want to get on and chat?
Yeah.
Yeah.
Hi. I'm sorry I'm off the screen. It's something that I don't like to do, but I'm not feeling well today, so I'm home hanging out. It's not menopausal, so it's some upper respiratory thing. But this is really great, and I think has led itself to some work across the country and relates to some of the other work that's been done, some of which came out during the presidential campaign in very bizarre ways about providing menstruation products that many of these issues are related around women's health. So this would be awesome to get a national movement going and get our partners lined up. And our accrediting bodies for our healthcare providers are also ways to influence the educational content that providers get, as well as those people that do the quality assessments like NCQA and the American Hospital Association. There are ways to begin to influence them so that they have standards that relate to women's health. So this is great. Thank you so much for letting me join you.
No, I'm excited to like I said, it's exciting to have like a group of people that want to move the needle and start having this conversation that we probably so we're not suffering alone in silence. I don't know. Are there any other questions that were included in the thing? I know that recently I've started having conversations, and I think someone had mentioned it in there about how a lot of times people that are undergoing breast cancer or cancer surgeries have, get thrust into menopause and some of those systems earlier. So I think partnering just, I've already come up with like a list in my head and I'm taking down notes of like other unique partnerships that we can do. I had never even thought about like connecting with business and industry and chambers and labor organizations. But it is very much a workforce development. So I think these are all great ideas, and I'm hoping that people will take these back to their states and, run with them, and we'll see that like snowball effect around this area.
So we have another question about health insurance companies. What role do you see health insurance companies taking in this area?
I'm going to let Melinda do that.
Yeah, I'm happy to. So, FDA approval for testosterone for women would open the door in terms of that being covered. What really moves the needle with the health plans is the large self-insured employers. So, those of us who have more than a couple thousand employees are generally self-insured, which means we have the benefit of ERISA. We don't have to comply with every single state mandate. But it's also our dollars at the end of the day. So what we cover, how we cover it is an employer decision as opposed to the health plan's decision. So if you find your more progressive employers, those who are recruiting in a tighter talent pool, those who have more women, those are going to be your the ones who are leading the way in terms of what really good coverage looks like. There's a lot more attention now on a Deloitte study that shows even setting aside pregnancy, women are spending more on healthcare than men, period. So it's like, okay, what's driving that? What's behind it? So there are employer coalitions that are national. There's some at the state level where you're going to have a lot of employers coming together and having these types of conversations. So I think talking to some of those local coalitions to understand the appetite for driving change, giving them the education and information that might help them. This hasn't been a topic on our radar because it's not high cost in the health plan, right? When we're talking high cost, we're looking at cancers and car accidents and big ticket items. This falls way under the radar because it's not where we're spending a lot in medical. It's more of like a productivity leak. And up till now, women have just, like we've talked about, it, kind of just dealt with it and suffered in silence. Like many other conditions that disproportionately impact women, the medical field's just treating the symptoms. It's okay, you have a headache, let's do this. You have a hot flash, let's do that. But there hasn't really been enough clinical study of what is the impact on a woman. And at least as importantly is, what's it look like after menstruation? Once you're truly in menopause, what are the impacts in terms of cardiac health? Why are 2/3 of Alzheimer's patients women? There's a whole lot we don't know because it's been understudied. So in terms of how do we drive change with the health plans, it's got to come from the purchasers, which are your largest employers.
I remember having a conversation about this and how you can engage some of those larger employers around like driving some of this change. From what I can tell, it isn't something that is like a high cost. It's not a high cost thing. And so, I think reaching out to some of these professions that have been led by predominantly women, whether it's engaging with teachers unions or nursing unions. I know there's a bunch of nurses on here that are seeing this and suffering through this in greater proportion than their colleagues. And having those kind of conversations and seeing if we can engage kind of unusual allies in the workforce to drive that change with some of those off-label uses. And if we started doing more research, we would know that, some of these things, like you had brought up, 2 out of every 3 Alzheimer's patients is a woman. Why is that? And are there things that we can do? And are they related? Are they not related? Are there things that we should be studying? And so those are some of the things that I know that in my state I've thought about doing. Like, do we need to just direct people to do research in this area because they're not doing it on their own? So perhaps creating like an incentive or a function for them to be able to do that might also do that as well.
So most of these questions are some of them have already been answered and some of them bleed together. So I have one more, and then I thought we could just let everyone discuss instead of, just putting it in the chat. So the last one I have here is what's the greatest legislative priority? A push for broadening general practitioner education or expanding access?
Well, I think before I got into this, I thought it was just generally expanding access, but I do think that what I've learned through the experiences of other legislative members that have introduced legislation and not been successful is that we still need a lot of education. We still need to educate legislators. We need to empower women to speak openly about hot flashes and brain fog without worrying about, I mean, it's so loaded. Like you talk about brain fog, and then there is a sect of the population that will talk about, well, this is why women can't be doing these jobs because they have like memory issues or they have issues like this. And so I think, there's a huge education piece that, has become more of my focus because I didn't realize we weren't as progressive as a nation in this area than I had hoped we were. So for me, I think like starting that foundation so we can educate people on, educate our doctors, educate our medical professionals, educate our workforce, and have those conversations, as awkward as it is, I think is probably what will start to move that policy conversation forward.
Great.
And I agree. I don't know if there's any, I feel bad because I feel like I'm just lecturing here and that's really boring. But is there anyone that has any thoughts that just wants to talk about their experiences in their state or their own personal experiences or their employment experiences or any partnerships that they've thought about doing, or if you're in the medical field or if you're in the nursing profession where you think there might be an area, a way to move that needle or have that conversation? Look at that. I may get everyone to lunch on time.
This is Shirley again. I put lots of thoughts. I think this is really awesome. It's increased my to be done list. One of the things, I don't know how familiar people are with Academy Health, but it's a national health policy organization. Really crosses across. It's interprofessional, but really focused on research and policy and the intersection there. This would be a great session to have at Academy Health. And I haven't submitted anything to them for a million years, but if anybody's interested in thinking about putting it together, I could reach out and see if they are interested. And there are a number of industry people there at these annual meetings. They're pretty big attendance wise. So that's one thought about moving it forward. And I think to have CSG National take some leadership in this would be wonderful. And partnering with, there's a lot of I know the nursing organizations, but I think there are medical organizations as well, and maybe forming some kind of a national coalition focused on women's health. We've done this around maternal child health, and I think that's been helpful. So I think there's a lot that we can think about doing to foster both the research as well as moving the policy envelope and providing the evidence for creating good policy. So I love it. Thank you so much.
No, I think that sounds great. And I know that we had initially talked about presenting at the conference on this topic, but we weren't able to, get that under there's a lot of topics within health, health and human services, unfortunately. So I'm really grateful that CSG West was able to help me kind of facilitate this like virtual presentation on this. But I think that's where we start. Like, I know I'm in the process in my own state, in my own community of putting together like a viewing of the M Factor, because I think sometimes having those conversations, getting people in the room, talking about that is another way to, you know, talk about the disparities that women face in health, not just, I mean, unfortunately, from birth till like death, we have those inequities. So there's that. I see Emily has her hand raised, so I'll just go to her. If you want to raise your hand, I can just call on people.
Thank you so much. I really I'm only 43. I just had a partial hysterectomy trying to deal with some of my issues. I've been dealing with this since I was probably 36. And being so young, struggling with symptoms, it was really hard to get any sort of help or diagnosis. But I totally agree with Shirley, you know, in trying to keep this conversation going and finding ways to get coalitions. And so really, I just, when I saw this come through my email, I was like, I have to be on this call. I was just really excited. And the ideas and information that you guys have put forward here. I'm in Oregon, so I'm your next door neighbor to the north. So anyway, I just really appreciate it. Thank you for the legislation that you put in the box. I've got some friends that we all struggle through this together. And so looking forward to see what we can do this next session. So thank you so much.
That's what I love to hear. I'm
Maybe y'all can have a viewing.
actually headed to your state. I grew up in Vancouver, Washington, so I'm headed there in a couple days. So do we see anything else on here? I'm looking.
I do want to add the book recommendation that Representative McIntyre also provided to us. I'll put the publisher link here. It's the new menopause book by Mary Claire Haver, which is she's a medical doctor, so I'll include that here. Certainly, if anybody wants to put together a book club, that would be a good read.
And I'll just say, so she has that book, which not only it's an easy read, right? Because we're all in it. So everything she says, you just are like eating it up because you're like, oh my gosh, I'm making sense. She really attributes a lot of it to food. So she has an additional book called The Galveston Diet that kind of goes through eating. She does intermittent fasting. And then there's also, I can't remember who wrote it, but there's another lady that wrote Fast Like a Girl. And she also has a menopause fasting book, The Menopause Reset. So there's a lot of information out there, but I think the thing that's so complicated is that we're all so different, right? Like for one person, fasting could be the best thing that you've ever done, right? For another person, that could be the absolute worst thing that you've ever done. So it's trying to find what works for you, which makes this so complicated and makes these conversations so important because there is no one perfect fix. It's just not that simple. So okay, sorry. I'm excited about this. I'm stopping, but anyway, very exciting.
I like the momentum. Do we have any other questions or concerns? I see the book is in the chat. Yes, I see him in here. Perfect. And as far as having like other speakers, like I would encourage everyone to engage in CSG West. If you obviously received this email, you're either a legislator, adjacent, you have some interest in supporting legislative and policy action. And there are so many opportunities to be able to like take some of these topics and really get into the weeds and try to have conversations. So when things like, you know, being a co-chair of CSG West, you think, when am I going to fit that into my schedule? I think there are really opportunities to be able to talk about topics, especially that are affecting more than just your state and every state. And in a topic like this, I think we really can do more damage if we do it collectively. And we have some momentum amongst our states to see what works and what doesn't. I see Courtney on here with her hand raised. Go ahead.
Hi, and thank you. And I just kind of wanted to build off what I'm hearing. I would love this if this could be not a last conversation. I just like my colleague, Emily. It's so good to see you, Emily. We are Oregon representatives. and also home today recovering from a hysterectomy. So when I saw this come through, I was like, oh my gosh, I really want to be there because I want to know more about how, you know, a lived experience or something I care about can be something that I really work on. Knowing that you all have come together today with that also at the forefront, I want to figure out what our next steps are so that we don't lose potential momentum to work together. If we are going to take steps in a state like Oregon or elsewhere, wanting to make sure that we're learning from others. So would it be CSG that would be continuing to organize us? Is there somebody here that's already agreed to organize? And I don't know the structure, but I am one person that would love to be part of an ongoing conversation. So just want to ask if we could build, you know, a next step that we could look forward to. And I'm grateful for everybody that choiced in today. And for opening this conversation. And hopefully, as we do get parity in our legislatures, and even if we don't, ideally, we're able to amplify this conversation meaningfully in ways that can't be ignored, because I think it's a really relevant and important thing that we're talking about today.
I think, I'm not sure, Shilpa, when does my term end?
Unfortunately, the new biennium starts in January. So, but you have to realize this is a member-driven organization. So what I've felt today is a groundswell. I do not feel like this is the last of this. So I don't see why this couldn't be an issue that the health committee continues on. Somebody had mentioned bringing national into it. You know, I haven't figured it out, but in my mind, I don't think that this is the last we're ever going to talk about it. I think that it's just the beginning. So whether it remains housed in CSG West, which I think it's great, it started here, and whatever we can do to build on this groundswell and take it to higher levels, I would say we'd be all in on that. So, and you know, we're not going to get rid of Senator Nguyen. I'm going to drag her along as a emeritus co-chair.
You will not get rid of me. But I will tell you, one of the things that I've learned, and for those of legislators that, you know, have participated a lot in CSG West or a little, or now interested in participating more, some of the programming and some of the connections that you can make in there, there's really a lot of opportunity. I would suggest that you talk to your leadership and about being appointed to some of those roles. That's how I ended up here. I ended up, you know, learning more about it, obviously, through the WLA, like Leadership Academy. And then I was like, oh, there's like a lot of opportunity to further discuss regional issues with other state legislators in an open way. And honestly, I've been able to drive whatever conversations I wanted to in the healthcare space through CSG West. So I would look at the new biennium, and they're always posted on who the new chairs are, and then contacting them directly, contacting Shilpa, because she will like help direct those conversations. And if there's ever opportunities to do stuff, you know, I will continue to, you know, work with them to help facilitate any future conversations. I do see a hand raised for a while here from Caroline. Is that correct?
It's Carolyn.
Carolyn, sorry.
It's Carolyn Eslick, state representative for the 39th district in the state of Washington. Just got reelected, my third term. Yeah, really. So what I wanted, first of all, thank you for inviting me, and I appreciate this movement of us, of the women. I felt this in May that we needed a movement for us. And so I revived my Facebook and my group of women called Women in Motion. I started it in 2011 and it died, and then I revived it in May because I felt that we needed to be together. And my motto is women empowering women. It is not for business, it is not for political, and it is not a religious organization. And it is all about coming together and empowering each other and living through our lives with each other. And so this group which I've not been familiar with until just this moment, as I will be looking further into it, feels like it's what we need to be doing in a national way also. So thank you for this. And I will be telling, I have an event on Monday night. I will be announcing this to them so that they can come and visit you also. So thank you.
I'm seeing that in the chat too. I mean, that might be something that people consider is if you have like a women's caucus. We don't need a women's caucus in Nevada because we're all women for the most part. So it's just a normal caucus meeting. But I think women's caucuses like is a really good starting place to have these conversations because they tend to be like nonpartisan, bipartisan, bring in a bunch of people. This really hasn't been like a partisan issue that I've seen across like the states that have introduced this. I think it's a lack of education for the most part. And I think I had mentioned that before. So I really do think that's a good opportunity as well. And, you know, I know CSG West has always been a national, and some other organizations that are out there have always been really good about if you come up with like an idea that like affects a certain like community that people have interest in, a lot of times they will be willing to host some of these conversations across this. I think this is a unique opportunity just because we can learn from what our other Western region states are doing, where their hiccups were, where they had problems, and how we can, you know, move that needle. I don't know. Do we have any other questions? I don't want to hold people here too long. I mean, I could stay here forever because I enjoy talking about this. It gives me comfort and some inspiration to keep moving forward. But
I wanted to invite Marta if she would like to give a few words about, you know, next steps. And she's our director, so
perfect.
You know, this is just starting, so I'm sure she has a flood of ideas too. If you have something to share.
Thanks so much, Shilpa, and thank you, Senator, for your leadership on this issue. Obviously, it's something that's important to so many different people from our states. You know, just as a background, with CSG West serving 13 Western legislatures. By the way, New Mexico also female majority after this election. So I know Nevada, then Arizona. Now New Mexico as well. So we'll be sure to amplify this information and share with others as well. We are at a unique place in sort of in planning for policy purposes. So we have our officers that are 4 officers that sort of serve as our board for the organization coming into Sacramento the Monday and Tuesday of Thanksgiving week. So we will be sitting down with them and they will be setting the stage for the next 2 years for the 25-26 biennium. Obviously, we'll be sharing what a success this was and the participation and the interest in continuing this, whether it's part of the health committee or whether, you know, it even goes further with our other regions and national as well. But yeah, Senator, thank you for your kind words about CSG West. You know, definitely want to make sure that, you know, any legislators on here, any staff of legislators on here also know that if you are interested in serving in a leadership capacity, if you're interested in a particular subject that you'd like to have this kind of gathering through a legislative exchange, you know, most people can carve out an hour and a half of their day a lot easier than they can a full day of flying to a location for an event. So this is one way that we can bring lots of different topics, especially those that may not even fit very comfortably into our committees as they're currently set. But we will be sending out information on those new committees. We will also be informing you of the new leadership for those committees. Typically, they do come from our Western Legislative Academy alumni, just because those folks tend to come in and then stay involved. But, you know, really want to open the door for everyone. Shilpa and I are certainly available. I know our colleague, Jackie Tanetti, who handles our natural resources portfolio, is also on here. And so I just want to leave the door open for any of you to reach out to us. We'll drop our emails in the chat. And thank you for your time today. This has been a fantastic conversation.
No, thank you. And I will leave it there. I don't know if it's possible to get a list of like participants that we might be able to share with any kind of follow-up documentation or anything like that, but I think that would be really helpful. And I want to thank you guys all for indulging me on some of my more interesting tangents, but I wouldn't be able to do this without all of you guys. And I know I'm really excited to see all the people that attended, and I hopefully we'll see a groundswell of momentum here and we'll be able to move forward. And the next time we meet, we will be able to talk about all the new legislation that is passed.